Alcohol, while often socially accepted as a casual indulgence, poses serious and sometimes underestimated risks for individuals with diabetes, particularly when consumed in excess. Unlike foods that primarily raise blood sugar, alcohol exerts a complex and potentially dangerous effect on glucose regulation. Ethanol interferes directly with the liver's ability to produce and release glucose into the bloodstream, which can lead to hypoglycemia, especially when alcohol is consumed on an empty stomach or alongside diabetes medications, such as insulin or sulfonylureas. This suppression of glucose production can be rapid and unpredictable, placing diabetics at immediate risk for dangerously low blood sugar episodes, which can result in dizziness, confusion, loss of consciousness, seizures, or even death if untreated. Beyond the risk of hypoglycemia, alcohol has long-term metabolic consequences that further endanger individuals with diabetes. Chronic excessive drinking contributes to impaired insulin sensitivity, making the body less able to regulate glucose effectively. This means that, over time, the same amount of carbohydrate intake results in higher blood sugar levels, creating a vicious cycle of worsening glycemic control. Regular alcohol consumption can also accelerate the development of visceral fat, further promoting insulin resistance and exacerbating type 2 diabetes progression. In type 1 diabetes, alcohol complicates insulin dosing by introducing unpredictable fluctuations in blood sugar, often resulting in dangerous swings between hyperglycemia and hypoglycemia. The liver is particularly vulnerable to alcohol's toxic effects. Excessive alcohol intake can lead to fatty liver disease, alcoholic hepatitis, and cirrhosis, all of which interfere with the liver's ability to store and release glucose properly. For diabetics, who rely on precise glucose regulation, liver dysfunction amplifies the risk of both hypoglycemia and hyperglycemia. Additionally, alcohol metabolism increases the production of reactive oxygen species, creating oxidative stress that damages cells and blood vessels. This contributes to the progression of diabetic complications, including neuropathy, retinopathy, and cardiovascular disease, effectively accelerating the timeline of disease progression. Alcoholic beverages are also calorie-dense, and their consumption often contributes to weight gain, particularly abdominal obesity. This weight gain worsens insulin resistance, undermines glycemic control, and heightens the risk of metabolic syndrome. Mixed drinks and cocktails are frequently loaded with added sugars, further compounding blood glucose spikes and making it nearly impossible for diabetics to maintain stable control if alcohol is consumed regularly. Even seemingly moderate intake can have significant consequences when combined with poor dietary habits, sedentary lifestyle, or inadequate medication management. Psychologically, alcohol can impair judgment, leading to poor dietary choices and missed insulin doses, further destabilizing glucose control. Social situations involving drinking can create habitual patterns of excessive consumption that diabetics may find difficult to resist, increasing the likelihood of repeated episodes of hypoglycemia or hyperglycemia. The perceived social acceptability of alcohol masks its metabolic dangers, making it one of the most deceptive threats to diabetes management. Long-term consequences of excessive alcohol consumption in diabetics are profound. Chronic liver disease, worsening insulin resistance, weight gain, cardiovascular complications, neuropathy, and retinopathy all become more likely, and these complications interact synergistically to reduce life expectancy and quality of life. Each episode of hypoglycemia is not just a temporary danger. It represents a strain on the cardiovascular and nervous systems, increasing the risk of severe acute events. Over time, repeated exposure to alcohol's metabolic effects accelerates the progression of diabetes, making the condition harder to manage and increasing the likelihood of severe complications that are costly and sometimes irreversible. In conclusion, alcohol in excess is far more than a social indulgence for diabetics. It is a potent metabolic disruptor that can cause immediate dangers such as hypoglycemia and long-term harm, including worsened insulin resistance, liver damage, and accelerated diabetic complications. Its effects are multifaceted, unpredictable, and cumulative. For those managing diabetes, avoiding or strictly limiting alcohol is essential. Each drink carries potential risks that extend beyond blood sugar fluctuations, threatening long-term health, organ function, and survival. Excessive alcohol consumption is not a minor concern but a serious, avoidable contributor to worsening disease and preventable complications.